Welcome to The Disappearing Mind, a unique podcast helping you find clarity and support along your dementia journey. Now, join National Dementia Trainer and Coach Dawn Platt for an all-new episode.
Welcome to the Disappearing Mind podcast. I'm your host, Dawn Platt, dementia coach and memory care professional. In today's episode, we're going to walk through something that causes a lot of anxiety for families: the first neurological appointment. If you've been waiting months to get in to see the neurologist, unsure of what a neurologist actually does, worried about what questions to ask, or you're afraid of what the appointment might mean, this episode is for you. My goal today is to replace fear with clarity so that you can walk into that visit prepared, informed, and confident. Thanks for joining me today on the podcast. This is a podcast that I really feel like is important. I know that I say that a lot, but this one is something that people ask a lot because actually, if you've never been to a neurologist and this is your first time, you have absolutely no idea what's going to happen, what kind of doctor it is, and what you should really do. And I've had a lot of families come away very disappointed. And a lot of that disappointment comes because they don't know what to say or they don't know what to ask. And so we're going to cover that today so that you are better prepared and have a little better understanding of that neurology appointment, especially the first one. Some of the things that you can take, some of the things that you can ask, and really knowing what to expect, I think, is important. And listen, being prepared when you go to a neurology appointment helps the neurologist determine what's going on. It may determine their decision on what type and course of treatment, what tests that they may offer you, lots and lots of things. So this is another one of those episodes that are going to require a pen and pencil and a pad so that you can write down some of these things or re-listen to this episode, because I can tell you more than not that 4 out of 5 families report to me that they went to the neurologist and they don't know any more than they did before they went. And we don't want that. I mean, there is a waiting game, but understanding the approach and what they do. I mean, they're a diagnostician, meaning they're someone that is a specialist. It's going to take them some time and treatment, but they're experts at what they do in brain health, in and around the brain. And it's really important that you have a neurology appointment if you suspect dementia, because they're the experts and you're going to want to know your diagnosis and treatment options. So let's get into it. One of the reasons why the first neurology visit feels so intimidating is for many families, this appointment feels like a point of no return. It can feel like once we see the neurologist, everything changes. I've had families tell me that. What if they confirm our worst fears? What if nothing shows up and we're back to square one? Here's the truth. A neurology visit is not a verdict. It's an investigation. Let me say that again. A neurology visit is not a verdict. It's an investigation. And you need that expertise in investigating what is going on, especially if you're suspecting dementia. Let's talk about what a neurologist does, okay, and how they're different from your primary care doctor. They're very, very different because they're specialized. Your primary care physician or your family doctor is often the first to notice cognitive concerns. They may do some brief screenings, may review medications, and may rule out obvious medical causes that could be contributing to cognitive disorders. But a neurologist, on the other hand, is a specialist in the brain and nervous system. They look at how cognition, behavior, and function all work together. It's their specialty. They evaluate patterns over time, not just one snapshot. If you didn't listen to the episode on normal aging, when to get an evaluation, you're going to want to, because I talk extensively about patterns. but they evaluate these patterns over time, not a single incident or a snapshot. And it helps determine why changes are happening, not just that they are happening. Think of it this way. Your primary doctor opens the door. The neurologist looks down the hallway. That's really important. Could take time, could take a number of tests, could take a few visits. And I know that you've waited a long time because neurologists are highly sought after and kind of hard to get into. In some places, it takes a long time for that to happen. The reason that they're so hard to access and why they're still important is in many areas there is a shortage of neurologists, especially those who specialize in cognitive disorders. So it's not uncommon to wait 3 to 6 months for an initial appointment and additional weeks for testing. I want you to be aware of that, and more time for follow-up discussions. This is a process, and that's why I encourage you to start early, to start getting these testing, start the evaluation process, because it's going to take time. It's not going to be one visit. This delay, I know, is frustrating. I hear that all the time, but it's also why getting on the schedule early matters. If you don't see a neurologist frequently, I want you to know that their role is critical, especially in dementia. And there are a number of reasons why, and I know you love your physician and you've probably been going to him for 25 or 30 years, but a neurologist is a specialist, and here's what they do. They establish a diagnostic framework, meaning they order the right test, read the right test, interpret the right test to give you accurate information and diagnosis. They also guide treatment decisions, the best treatment, the latest, the greatest, the effective treatment decisions, which is critical. They support your primary doctor with recommendations. That's really, really important when you go to a specialist like a neurologist. And they help rule out other neurological conditions or medical conditions that could be contributing to the symptoms that you're seeing. What this appointment is not, and I want to clear up some misconceptions because I don't want you to have them so that you're not disappointed. This appointment with the neurologist is not a single test that gives all the answers. It is not that. It is not the guarantee of a diagnosis. It is also not a sign that things are too far gone. That's not what it is. Early intervention, treatment, diagnosis are critical with a neurologist, and I recommend a neurologist to everyone who thinks they're dealing with dementia. And it is not a loss of independence in itself. It's an opportunity. A daughter once told me, I thought we'd walk out with a diagnosis and a plan that day. Instead, they walked out with next steps, and that is exactly what they needed. You're not going to go in and come out. You're going to have tests ordered. You're going to have a lot of questions you're answering, but you're probably not going to get the final diagnosis on your first visit. As a matter of fact, that's probably not at all going to happen. How does a neurologist go about evaluating and diagnosing cognitive change? It's so critical and important that you realize how important they are. Your family physician is not well trained in dementia. They've seen it, they've treated it, but a neurologist is a specialist at it. And if you're interested in the latest and greatest treatment options and specific diagnosis and treatment, a neurologist is going to fulfill that for you. Here's some of the things that they look at. A neurologist looks at your entire medical history and that of your family. Any functional changes that you've had, factual functional changes, any cognitive screening results, they evaluate that. They do imaging and lab work, that's blood work, and they look for input from family or care partners as a way to compile all this information that they're looking at. Some of the common tests that they may order for you would be cognitive assessment, maybe an MRI or a CT scan, blood work to rule out any reversible cause that may be happening, And sometimes they may order neuropsychological testing, which can be a little bit more in depth to use in their diagnosis. It's important to know also that some tests are done the same day, others are scheduled weeks later, and results may come in stages, not all at once. And I think in conclusion of that, it's a process. And when you know that, it will also help you in making the decision of how quickly you get started. I just want families to be aware and not disappointed when you come out of that appointment today and realize that you just started the journey. But that really is the facts, folks. There may be some of you, and recently I had a family say, why does everything look normal? Everything looks normal isn't the end. Families often go to the neurologist and they often are relieved or confused when tests come back normal. But normal doesn't necessarily mean that nothing is wrong. It may mean that changes are very early or there's nothing happening in this area. It really is important that you go through all the testing. Maybe means the issue is functional, not structural. It may mean that more observation over time is needed, and you may get an appointment to come back in 6 months. Just because everything is normal at the moment doesn't mean everything is normal. Neurology often works in trends, not absolutes, and it does take time for a neurologist to get all the facts and really look at things, especially if you're having symptoms that aren't showing up on blood work or CT scans or things like that. It can take some time. So let's talk about how to prepare for the appointment. Preparation makes a huge difference. That's why I'm doing this session for you, because I want you to understand what you need to do before the visit. I think it will help you feel a little bit more satisfied with the visit and feel like that you've accomplished something. Before the visit, write down specific examples of changes. Focus on function, not labels. Focus on function, not labels, such as difficulty managing the finances, getting lost, repeating questions. Those are facts. Those are things that are happening. Always bring a list of medication. Always bring someone who knows the day-to-day picture. Don't leave it up to the person. Make sure there's someone there that can tell the neurologist about the day-to-day happenings of this person. And here's some of the things that you may want to consider saying. Instead of saying, we think it's dementia, you should say something like, we're noticing changes that are affecting daily life and safety. That framing matters because it's more factual of what your concerns are rather than general type of statement will help with your visit. Here's a list of questions, and I have a checklist at the end that I'll go over, and it will go up on our resource page. What do you want to ask? What are some of the questions you want to ask to get the most out of this visit? So here are some helpful questions. I put a list together. You can pick and choose, but I just put a list that I felt like is important. And you want to go in with a list or you're going to forget what to ask and come out of there disappointed. So here's question number 1 you could consider. What could be causing these changes? The neurologist may or may not answer that, but may give you more insight and understanding and education. What are we ruling out? What should we be watching for over time? What supports or interventions would help now, if any? How will you work with our primary doctor? Remember, you're not just here to get a diagnosis, you're here for guidance. And I think that those questions, even if you only use a few of them, are going to make you feel more confident in what's going on, make you feel like you got more out of the visit. Let's talk a little bit about how a neurologist works with your regular physician, because that's really important for you to know. Most neurologists do not manage day-to-day care long-term. That's not their specialty. That's not what they do. Instead, they provide diagnostic insight, meaning they're going to advise your doctor on what they think it could be or what they're looking at. They're going to recommend treatments or medications. Those may change. They may start with something find that it's effective or ineffective and make changes. They are going to work with your physician to guide monitoring and follow-up visits. Some of these visits may not happen for 6 months, but it's important because over time, you will see the change and they will be able to measure that change and provide accurate diagnosis and treatment. They will communicate findings with your primary care physician directly. Generally, you get that referral from your primary care physician. They will communicate and share records within their offices. You may only see a neurologist once or twice a year. That is not abnormal. Or you may only see a neurologist when something changes significantly. Otherwise, your primary care physician will manage your care with the consultation of a neurologist. So that doesn't mean that they're not involved. It means that they're working as part of your healthcare team. And it's important that you kind of understand this. Let's just talk a little bit about the emotional weight of the visit, because that's something that families share with me along the journey. It's normal. It's really normal to feel anxious or guarded, hopeful and afraid at the same time of what the outcome might be or what the neurologist is going to say. And I want you to remember this as you're preparing to go to your neurologist. Seeking evaluation is an act of care. It is not surrender. It's not the end. This knowledge is going to give you options. Options are going to give you control, and control reduces fear. These things are important and will give you an edge when you are care planning or getting a diagnosis in and around dementia. Seeking clarity, again, is not overreacting. Seeking clarity is an act of care. It's wisdom, and it's going to give you options that you are going to want to have. If you're waiting on a neurology appointment right now, or you're thinking about making one, I hope this episode helps you feel more prepared and less alone. This isn't about labels. It's about understanding what's happening and what support is needed next. You don't have to have the perfect questions or a full picture, but showing up informed, observant, and open is enough and very beneficial to your next neurology visit. I want to thank you for joining me today on The Disappearing Mind. Again, if this episode brought clarity on what to expect, please share it. Please subscribe. Please visit us on all platforms where you can find The Disappearing Mind, no matter where you listen to podcasts. We're also on Facebook. We're on Instagram. We're on YouTube. And remember, clarity is not something to fear. It's something to use. I have prepared for you a checklist that I want to briefly go over, and I will provide for my team so that this will be available to you. And you might want to consider printing it out before your next visit, and I think it will be helpful for you. I'm going to go over this briefly. I'm not going to go in depth. It is available at www.thedisappearingmind.com. in our resources page there on the podcast website. And we have lots of guides, lots of information, lots of material and resources for you. And I hope that it will be beneficial for you. So here's the companion checklist to your first neurology appointment that I've prepared for you. And that is, before the appointment, get on the schedule early. Ask the neurology referral as soon as concerns arise. Ask your physician for it. It's going to take some time. Observe patterns, not just memory lapses, but all of the things that are on the list, such as repeating stories and questions, trouble managing medications or finances, just increased defensiveness. The list goes on. Writing down specific examples. What changed? When did it start? How often does it happen? How is it affecting daily life? What to bring? A list of medications, medical history, all of those things. How to talk about your concerns. I think that will be really helpful. Helpful phrasing you might use on that visit. What to expect at the visit. Important things to know on your first visit. Possible tests that the neurologist may order or require that you complete. questions to ask the neurologist after the appointment, and important reminders. I think that this checklist is going to be really beneficial to you. And again, thank you for joining me on the podcast. Until next time, this is Dawn Platt. Make it a memorable day.
Thank you for joining us for the Disappearing Mind podcast. We hope it's helped you find clarity and support along your journey. Be sure to subscribe to never miss an episode, visit our website to suggest future topics, and share the podcast with friends and family.